Hello.
Thank you very much for coming again to Riga. We do appreciate a lot. And you have this time very specific lecture for our practitioners and for our association members. And this lecture specifically amazed me a lot because you gonna speak about the newest studies what we have or scientists have in the field of permanent makeup and tattoo. This is extremely important that we would like also to follow all the news, all the recommendations from the doctors, from the scientists, because I had the feeling that we are like divided. Practitioners is one planet and the science is another. So thank you very much for you coming here and explaining us all these complicated things. Because sometimes we cannot evaluate the problem as much as it should be evaluated. So today you're going to speak for our members about this about these newest studies that have happened during the last several years. And if we divide these studies, they are focused on some specific fields of the pigments or the health or all together. So what I would like to focus now on this clinical aspect of these studies. And you are like a dermatologist who has the practice, like everyday practice in the different countries. You work in Finland, you work in France, and you do the international consultations also. So in your daily dermatology practice, what is the most common complication you see after the tattooing or permanent makeup?
Well, it depends on if it's a permanent makeup or tattoo, traditional tattoos. If it's traditional tattoos, basically right now I see two kind of complications. I see a lot of overwork tattoos, which means that it's a technical problem that we will see maybe later. So the tattoos start to crust and doesn't heal well. So it's a technical problem with the tattooing procedure. And I see also a lot of granuloma, so these small lumps and bumps on black tattoos. That's what I see the most right now for tattoos. For permanent makeup, I see more various complications like anesthetic results, customers who are not very happy. I had also healing problems, especially when, we will see later also, I think when permanent artists have been trying to correct something or try to take off some inks with some procedures, so it makes it a bit worse. And also we also see this granuloma, also these lumps and bumps on makeup, especially on the eyebrows or on the lips.
Okay. Which complications are underestimated by practitioners, but actually occur more often than we think?
Well, yet again, we have to differentiate, if it's a tattooist or a permanent makeup artist. For the tattooist, I think they may underestimate the healing issues, because that's really what I think I see right now.
But there is always fights about how to heal properly. The recommendations are very different. So how to educate, how to choose the best for them. They don't actually know.
That's true that we have different techniques for healing and we don't know which one is the best. So you have the one with just a dressing that you keep, you have the one where you put a dressing at the beginning and put creams, or some people say just leave it like that. But this is not really a problem because at the end they heal, but I'm more talking about the healing problem because of technical issues, that it starts again to crust, to be painful, and sometimes I feel like the tattooist does not think that something happened from their side. But that's for the tattooist. For the permanent makeup artist, I would say it's more like hygiene issues. So it's very important to really try work in a non-sterile, but at least in a clean way with gloves, coat, mask if you really want, especially if you're sick. So you should cancel it if you're sick. And then I would say the other problem with a permanent makeup artist is when something goes wrong, try to overcorrect it again and again and again, or try to remove it. It's better than to delegate with the doctor to see what happened instead of trying to correct something and make it worse, and then we see the customer when too much damage has been done, because it's very hard to then correct it.
Mm-hmm. So this is the practical point of view. If the technician is not practiced enough, yes, he can overdo this. So this should be done properly on the training course to teach the student to work on the correct depth of the skin and not overdo it, better less than more. And okay, so this scarification after is quite common if we speak about bad teaching or bad education. At what point a practitioner should refer the client to the dermatologist?
Oh, that's very easy. At any time when the tattoo is not going, tattoo or permanent makeup is not healing as usual, or that something happens on a permanent makeup or a tattoo which was healed, and if the customer comes to them and says something is happening, they should anyway send it to the doctor. The only reason they can do something is when there is like some colors to put again because some colors hasn't fixed correctly, then they can re-tattoo. But anything that goes unusual to their experience, they should refer it because it's not normal.
So better not to wait until it's gone worse. Just right away send to the doctor.
Yes, avoid just put some moisturizer and go to see the doctor, because then it will be way much more easy to see how it is and if it has been re-tattooed, remodified. It's very complicated when we start to see people who have been having complications and the tattoo is tattooed over it to mask the complication, and then we don't really see anything, and then we don't know what's happening. So it's very complicated for us, for the customer, because we don't have the answer, and of course for the tattooist who don't know what happened.
Okay, but what are the signs that practitioners should never ignore before the treatment? If he sees something on the face, or if we speak about permanent makeup.
Before tattooing a patient, of course, if there is anything on the area, a mole, a spot, something that they don't know what it is about, better delay and either say like, I cannot do it, go to see a doctor to know what it is it safe to tattoo over it? And also we tend to say no usually to tattoo on anything, but it can be discussed. If the patient has a scar, you have to ask the patient what scar it is, because if it's just a cut, it's okay. If the patient say I got a basal cell carcinoma that has been operated, it's completely different for the management that you're going to provide. So basically anything unusual on the area which is planned should be an early sign of warning. Of course, you should inquire, or the patient should state what is his medical condition, if he's taking some medication that can disturb. Me, when I got a patient with acne and I give isotretinoin or Akutan, I always tell them like tattoo is no, because it happens often when I address them, they have a couple of tattoos and I say no tattoo, and I have sometimes a teenager who say like, I was planning to have a tattoo next week. Now we start the treatment, now it's over until we finish the session. So they have also to warn the permanent artist, makeup artist, that okay, that kind of thing.
So again, we go back to the school for the practitioner. We must have a list of for the proper consultation to be able to ask these questions. In case we have something suspicious or we see, we just refer to the dermatologist.
Yes, you should have a checklist. That's a
even me personally, I consult with you sometimes because I work with the patient after the basal carcinoma removal, and the oncologist send it to me when it's safe to tattoo over it, because sometimes these pieces of the skin transplanted, they are different from the skin around, so we have to color it for a person to be able to live the normal life and to make it visually better. So sometimes it is necessary for the patient to get the tattoo or like permanent makeup, medical camouflage, but only under the supervision of doctor.
Yeah, it's definitely a case-by-case discussion, because one can have exactly the same disease, but it's completely different, and it's also not your job as an artist to look at the report of the biopsy and see like, okay, is that enough? Is it good? It's not your job. So it's a doctor who has to explain. the patient has to know that there is always a risk of relapse, sometimes very late. And also it's a problem because now we discuss those pigment gives cancer. So if you start to tattoo something which has a scar of the cancer and then the cancer came back, everyone will ask, yeah, you put pigment which was at risk, it's your fault. So I think patients, if they are explained, for customers, if they are explained correctly why you should not, they understand, they are able to understand. We should not say no and not explain why. You should have a justification to see why you don't want to do it.
Yes, so we do not exclude absolutely the possibility for the client, but to be very careful is needed. Okay. Next. In your data, red pigments seem to be the main source of allergic reactions. Why is that still the case today?
That we don't know. We don't know. There is most likely there is lots of red pigments, these aromatic amines. Clearly, there are some that are more allergenic to some people, but we are not totally sure right now which one it is, and we know that it's maybe a byproduct, so it's not in the ink, but it's when you put it, and when it's metabolized in the skin, it changes, and then for some reason you just start to react, but we haven't yet identified. And also when a customer comes, we have to know which ink has been used, which pigment is there, if possible the batch, but that's very difficult because people can come months or years after. We have the problem that sometimes the tattooists don't remember, because I hardly believe that in months after he remember which red he used, so when they send the bottle, I'm not even sure, like, was it really this one? So it's very difficult to advise the patient, and the allergic tests are not reliable. So we have to then say to the patient, to the customer, like, no more red in general.
But in case of us, it's much easier to follow which colors were used for the patient in case he gets some allergy or any kind of reaction, because we put in a consent form, we put the number, and it should be like this. Yes. And every time I buy a new pigment, it has the QR code together with inside of the box, so I put it in a specific book. So either the client or me or the doctor can request for information, and I can see right away when it was produced, what was the batch number and stuff. So if you keep the documents properly, this is not a problem, and it's very safety this way, and it helps to doctors to understand the reason, and for manufacturers also. So that's our common job, to protect our clients.
Yeah, definitely, it's an excellent idea. I know they do it also in Denmark, but in France, for instance, or in Finland, I'm not totally sure. It's more like, remember which ink you used. Very basic.
Yes. Well, that's why a lot of technicians ignore, because it takes time to get all the documentation, and only few manufacturers offer this service with these QR codes and stuff, which it makes easier for practitioners to follow all these rules. But it's a shame when practitioners do not pay attention for this, and we would like it to fix it later, so everyone would understand why safety is necessary. Have you seen a decrease of reactions since REACH regulations came into force?
I have to admit that I didn't pay attention, meaning that when the patient comes, I just write what happened to them. I should do the study. I should compare before REACH and after REACH if I see a difference, but right now I don't have the feeling that it's visible, but there is lots of explanation for that. I think it's a bit too short. We are in 2026, it came into force 2022, 2023. We know that the tattooists have used most likely the same ink after, so
and they still do.
They still possibly do it.
Yes,
yeah, that's true.
So
there is that. There are tattooists also who are using, of course, non-REACH components that they order from another country. That's, I know it happens.
Yes.
So there is lots of, and you can also be a customer and go abroad to another country which is not EU, So then you will have a non-compliant non-compliant batch. So you have lots of reasons for which we may not see any effect yet, but we still have now to make, now when we reach 5 years, I think we should make a study comparing the 5 years with the 5 years, and I think you have to take the point that we have also to take off the COVID period because it was a weird time. We had tattooists have less customers, so it has impacted, and also COVID sometimes has triggered reactions. So I think we have to take before COVID and then check, do we see less or not? But then there's also the question, do people take less red? Because when I look at the Gen Z, they are really getting tattooed in black. So maybe we're going to see less red complication just because the fashion is also. So there is lots of things to take it. It's not that easy to just say like, yeah, we see an answer or not.
Yes, unfortunately, we cannot make an experiment, pure experiment, when all the other pigments beside rich are banned, which is not. We will never get this, so it's hard to say that we see the obvious decreasing of the problems. Okay. But do you think that modern organic pigments safer than metal-based ones?
Yes, I think, because first we have a regulation that has been going on since 23, so it's been 20 years. There have been an EU regulation in 23, in 28. Now there is a REACH, which is not perfect, but we have regulations. We have limitation of metallic salts, so the inks should be safer on the paper.
Okay.
Now the question is that's true that still, when some national health agencies are testing inks, we still have surprises. We still have that the batch is not mentioning the correct pigment, or they still have too high levels. So it's safer, but it's not perfect. For numerous reasons, the legislation is not maybe totally adapted, but also the manufacturing process is not also perfect according to the brands, which is a problem.
Okay, so this is a very controversial question to discuss right now about, absolutely, yes, because we used to use the metal-based pigments since 30 years for permanent makeup specifically, because the color of them are much more appropriate for the face. They are not so bright and luminous, and we don't need these organic specifications sometimes. So, well, let's see. Okay, let's talk about the education of the technicians. Today we see a growing trend for short training courses in the permanent makeup, and sometimes just a few days. And from medical perspective, how risky is this?
Well, I don't know, it depends actually who is doing these lectures, because you have to be, I mean, I don't know, but for France you have to have an agreement with the government, not with the government, with the health agencies, that not anyone can become a trainer for tattooing and permanent makeup artist, so you should have a certification for that, so not anyone can improvise to be a teacher, because you still have lots of knowledge of complication, etc. to know about, to explain, so this is a bit problematic. Especially because if the training is too short, then the person is going to believe that she or he knows everything based on the little diploma he will get. So yeah, it's a bit of a problem. I would say medically, ethically, safety for the customer, because it's not really enough. If the person who trains is not him or herself already accredited to do it, of course, so it's not really a good thing, yes. And I think it's a loss of money. I assume you pay for it, so I guess it's loss of money for the technician who wants to attend this lecture as well.
This is also an ethical question. How can you touch the people, interact with the other person's body if you don't have proper knowledge about the possible damages or even the contraindications and stuff, precautions? There is the whole thing that you have to learn before even to approach
Of course. And you have to be able to handle also when there's a complication or something happening, you have to know what to say, what to do.
Yes, because you can discreditize the industry in general if you do this. Okay, I agree. In your clinical experience, do complications more often come from poor quality pigments or from poorly trained practitioners?
It's not very easy because well, of course,
poorly trained practitioners used poor quality pigments.
That makes sense. That comes together.
Yes.
So in this case, problem is solved. It's both. You can have, of course, good technicians or good tattooists who uses ink. They may not know our low quality, because this is a problem. What, for instance, if a tattoo is by rich compliant, so it can be both. Of course, usually it's, in this case it's a case. The problem that you can have also well-trained technicians who have bought poor quality inks, either because it's cheaper from side market and not official market, but you can also have inks that are labeled rich compliant, and you have to believe it's true. And of course we know that sometimes some inks do write it's rich compliant when it's not, or when the composition is not correct. But that you cannot do anything, because it's your good faith that you bought it, so no one is going to blame you for using a wrong ink if you didn't know. But it's true that when I show the picture of tattoo complications to tattooists, it's true that I don't judge the quality of the tattoo when I see it, but I have to see that they are reacting. I know they see that the tattoo is not very nice, the hand has not been steady, and me too, I see it like most of the time. Yeah, it's true that it seems that the quality of the tattoo itself is not perfect. I have seen complication on very nice tattoos, it can happen, but that's true that when I look at my own picture, I'm like, they are not, the tattooists are not wrong, and like, yeah, it's quite a nasty one. And so there is clearly, it's still hard not to believe nowadays now, after 15 years, 20 years of seeing complication. That's true that it's hard to believe that the technique of the tattooist is not sometimes involved, not in every complication, for the tattoo allergy, for the colors that you cannot predict, but the granuloma, the overworked tattoo, the infection, there is often a low quality technique of the tattooist.
As for me, I believe that the well-educated practitioner cannot choose poor pigment, because even now there are so many information about how to choose and how to check properly. Because, for example, Michael Dirks, that we know very well, he explained how not to hook on this what manufacturer says. He explains how to check the data, and this is now an inevitable ability of the technician, of the practitioner, to read the ingredients, to find the certificates, and that's how you can protect yourself and your clients if you are responsible. So I personally believe that the education level also gives this necessary knowledge. How
I totally agree, and of course tattooists also, when they feel like the ink is not going as good, they just switch also, and they talk together, of course, about the brands, so they know which brands are to avoid and which brands are correct in the country.
The problem is that we have a lot of influencers now who just only say, oh, this color is good, without any proper base under this statement. Because it's not about the color, it's even not about how easy it goes inside of the skin. And maybe that's actually a sign of a not very good pigment, if it very easy goes inside of the skin. Maybe there isn't a lot of alcohol or something like this. So we should definitely, in nowadays, at this proper situation, at these times, to check carefully, not to fool ourselves by influencers, by nasty manufacturers. And yes, this is how we keep our practice protected. Can regulations alone compensate for a lack of education and clinical understanding among practitioners?
No, the legislation is just a little thing. You have to have a training. That's very clear. No, it can't.
You're gonna speak today also about some studies, and some studies shows that the pigment migration to lymph nodes and the organs. And how clinically relevant is this?
Well, we know for 40 years at least, that when you have a tattoo somewhere, well, you have a bit of pigment visible in the lymph node. It's really known. It was even known 100 years ago. Doctors were already predicting it, that it migrates. So it's nothing new. We know it. So the clinical relevance is that some people, sometimes after tattooing, can have an acute lymph node and it would go away. That's just inflammation. But you have some people sometimes who have always lymph nodes. We can palpate it, usually in the same area as a tattoo. The problem is that it is most likely pigment that has migrated in the lymph node. It doesn't disturb anything, that it's just a bit bigger. But in this case, usually you have to go to the doctor, you have to have tests, and usually we have to take off the lymph node completely, because you have to be sure that the reason why the lymph node is big is because of the pigment. Because you don't want, you have a young man or a young woman with a lymph node, your first thought it's cancer, it's lymphoma, irrespective of whether you have a tattoo or not. So that's a problem. So it's relevant, and the people should know about it, because when they go to the doctor for another reason, they may, for some reason, find the lymph node, or if they get an operation, find the lymph node by accident. They have to know, like, okay, he got a tattoo, so maybe it's because of the tattoo. So that's important. We also have this problem with imaging. Someone gets a scanner, or even mammography. We know that for mammography sometimes people will see, like, I see something there, so we have to go and look, and it was just a pigment and no cancer of the breast. So it, of course, triggers lots of stress because of the exploration until the answer. But it's important that that's relevant. So it's important that the tattooist, the permanent makeup artist, warn about this possibility. The customer has to know about it in the future, just to avoid unnecessary stress, but to also know what we are looking for when we are going to take off the lymph node. But otherwise, so far today, there is not any proof that the fact that you have pigment in the lymph node is disturbing in any way that much the functioning of the lymph node.
Okay. But I do have cancer patients after the breast cancer when the lymph nodes also were removed, and then I tattoo areola in this area. Is it all right to keep doing this?
Well, the oncologist let the patient have a tattoo.
Again,
so
in cooperation with the doctor, we can decide.
Yes, there is no problem. That's true that now people started to think about that, because permanent makeup of the areola has been done also for years, and no one ever thought about that, oh, there is no lymph node, so what is the problem? So yes, pigment are migrating for sure.
To another lymph node.
To another lymph node, because they didn't take everything. So far, you can do it. And I mean, let's be very honest. If we think that way, you have a woman who had a surgery, radiotherapy, chemotherapy, hormone treatment for breast cancer. She wants to have now the tattoo done for closure, for femininity, etc. Are you going to tell her, like, I cannot do it because maybe somehow in 20 years you will get a cancer? And like, guy, I just had a cancer. And you know, if she has the other breast, she knows that she can even get it on the other one. So she already have. So please, like, let's be real in the way of thinking the benefit and the risk for the body image and the areola. It's very small, so you're not putting much things. So I think people who are saying no are really, I think today is my personal opinion, of course, it's over exaggerated.
And specifically then, okay, if we assume that the colors now are more clean, and this is also can be like a benefit.
And we have the experience now of thousands, millions of women who was having an nipple areola tattoos. Maybe no one has ever thought to check if there is a link with another cancer. Maybe it has to be checked. But again, it will be so difficult to show because people who have already a cancer, they have a risk of second cancer, etc. So,
I see. Okay, then after all we have discussed, should practitioners communicate this information to a client?
yes.
And if yes, how?
Yes,
Without making them more scared.
No, it has to be well, you usually give a paper about all the risks to the customer, so you can put like pigment is not fully staying on the skin and a little part can migrate in the lymph node, it can be found there, and so far there is no proof that there is a highly small, it doesn't affect infection, it's not proven that it gives today cancer. So they just have to know that it happens and remember to mention it also to the doctor if they go for further exploration. That's you may find pigment somewhere if you look for it. And
anyway, we do this approach way more professionally this way if we inform the patient about this. It's like buying pills in the pharmacy and then sign with the paper with all the possible complications and stuff, and this is absolutely normal for this practice. We're not make people to be scared, but to be informed, which is way much better.
And it's quite unlikely that the person will say no to the tattoo because
or
of
if he say no, it's all right.
Okay,
absolutely,
of course.
It's even better this way then after that, after some small complications appear and you're gonna be guilty. How do you think, do we understand long-term effects well enough today?
Do we understand?
Do we understand?
I mean that you're meaning side effect inside the body, not on the skin.
In the term of how long do we observe the tattoos and the permanent makeup? But still, there are so many things we don't know.
Well, the problem is that people who would like to see complication, it's never long enough. 10 years is not enough, 20 years is not enough, 30 years. They will always tell you until you die, it will not be enough. So, so far, we have currently not studies that have showed that tattoo pigment as such has an impact on the long term, except the possible local side effects on the tattoos. Whether it is on your immunity, on infections, or cancer. But again, it's how long you have to wait to see it. And then the more you get age, you have other risk factors that adds to the tattoo, so it will not be only the tattoo but other things. So it's going to be complicated. But so far, no, we don't have still today publication that shows.
Well, but the history of tattooing is so ancient that I don't believe that something could appear that would cancel the practice at all. I think it will never happen.
No.
The industry readapt, but everything what is happening right now, I think it's only for the best, the changes on this. Maybe it's not the best moment right now to discuss about the changes, but we will see in the long term. Not we, but maybe our kids and grandchildren. All right. Going back to your lecture, you're gonna speak also about vaccination and tattoos. And do tattoos affect vaccination outcomes in real clinical settings?
Okay, so you're mentioning, basically you're referring to one recent study that was under the spotlight in the news about vaccination alters immunity and vaccination. So it's important to understand that the study was just a single model, they have tattooed mice in a certain way. So they tattooed the foot and vaccinated the foot and check basically if the mouse had, to make it simple, more or less antibodies according to whether it's a tattooed mice or not.
Yes.
So I'm not going to go too much into detail, but they used 2 vaccines. One was against COVID and one was against the flu, because you cannot compare. One vaccine is not all the vaccine. So what they saw is that if they vaccinated the mouse which has tattoos against COVID, the mouse with tattoos had a lower level of antibodies compared to the mouse which was not tattooed. And then it was like, oh, yeah, that's it. Look, it alters the immunity. First we're talking about a mouse tattooed on the foot, but also, first I would say that having less antibodies, statistically less antibodies, doesn't mean no antibodies. So they have antibodies. So clearly, to have a tattoo in the model has an effect on the immune reaction. This is, you cannot doubt the result. But the interpretation for me is very different. It's like, first, they have still antibodies, not zero. Second, if you want to show if the tattoo has a risk, you should infect now the mouse with COVID and see if the mouse with tattoos dies of COVID or reacts. Yes, because that's the idea we want. Because it's not just saying, oh, he has less antibodies. It's say, does it work? So that's my first comment to reassure the people. Second, they vaccinated against the flu, and what happened this time is that the mouse with tattoos had a higher level of antibodies. It's written.
A surprise.
It's not. Yeah. So now we have a problem for this researcher because they have 2 vaccines, 2 different results. But they prefer in the public to say like, oh, it has affected COVID and blah blah blah, and they use the word alters, which I think is very negative for the tattoo. I think they should say modulate, because for one it was better, and me, I get my vaccination flu shot every year in my tattoo. So I should think like, I'm stronger maybe because I have higher level of antibodies, which is completely ridiculous to say that, I think, because yet again you have to prove it. That so overall the result about the vaccination and the tattoos show that yes, it modulates. For one vaccine it seems that it has lower, for the other one it doesn't make it better. So 1-1.
Okay.
So yeah, so should you get a vaccination in a tattoo? Not if you just got tattooed
right away,
of course, or you should not get a tattoo over a recent vaccine, because there are people who did that and that didn't go well.
Okay. Yeah.
It has been shown
inflammation and stuff.
It has been shown for military in the States who were getting this variola.
All right.
But the variola is alive, so he got a shot and get a tattoo 4 days after.
Okay.
So what can go wrong? But yes, and then he got the variola only on the tattoo. So that we say no. But if you have an old tattoo, so far I would say if the nurse doesn't feel confident, she can try to take the other arm or choose elsewhere. But if she cannot avoid, she's still in it.
Yeah, brilliant. You teach us that we also have to read these articles critically. Yes. Of course, sometimes it's not possible for lay people like we are, like regular practitioners, but that's why we have you to explain us critically about these studies, because they are sometimes also can be controversial.
But it's not that it's controversial.
Not controversial, but discussable. I mean,
it's more the way, as we discussed, the way it's given to the people in the newspaper.
Right.
Without any
because
filter.
the journalist loves scandals and stuff, and
because it took me 2 hours to read the article. Like very slowly to read it, because I'm not a researcher, so I cannot criticize the methodology how they did it. It's like, okay, you did it that way, and the results are there. It's just how you interpret the result and what do you want to say to people which are here. Like, and I say, no, right now I will still get my flu shot in my body, in the arm, in the shoulder.
And hope for best.
So poor, she gets the avian flu, so protect her.
If you want to enhance your antibodies against flu.
But right now, if I feel, honestly, the way they say it in the newspapers, they say like, don't get a vaccination because it alters, but it's wrong because I can say you get it better with the flu. So let's be logic, guys. Choose your poison, basically. You know?
Brilliant. Okay. You also have mentioned the nickel issue. Mm-hmm. And in your presentation, you suggest that the nickel exposure from tattooing is below harmful threshold. And how should we interpret this as practitioners?
The nickel issue is a bit of a problem because nickel is always in inks. It's always a contaminant, and as Michael or others will say, you cannot really get rid of it completely. Mm-hmm. You will always find it. But the question is whether it goes elsewhere in the body. It seems that it stays in the tattoo area. So the systemic fact that you would have nickel in the body seems very unlikely, but the article was just a model, and it was not a study. It was just they were like calculating and making approximation, etc. The real problem in practice is if someone has a nickel allergy, can he or she get a tattoo? Because that's the question. Mm-hmm. And currently we have not proven that people with nickel allergy were more likely to have an allergic tattoo reaction to a color. So what I usually say is that what we know that we don't know. We have no proof right now yet that it's a higher risk, simply because having an allergy to nickel, it's when you put it on the skin, but if you put in the skin, it's not totally the same exposure, so that's why you cannot compare. And then I just let the patient decide according to her confidence or level of stress. And if I see that they are very, very stressed and cannot be convinced, usually I say just get tattoo in black, because this is where there is a less nickel available, and don't take a color because then you are going to increase, especially red, you're going to maybe increase your risk, which again is not true, but for some people who are very, very stressed and cannot be reassured, it's better to tell them what to do because they may take a wrong decision. And if they unfortunately have a complication, even though it could be irrespective of the nickel problem, then it's a bit also your responsibility. So usually I say just take a tattoo in black if you really cannot get convinced of getting, or you feel scared, or usually they are first timers. They are people who never got tattoos, so they can try to get a tattoo in black and see how it goes. But otherwise, no, right now there is no proof, again, according to studies, that people with nickel allergy have a higher risk to develop an allergy to a tattoo.
Now in Latvia it was forbidden for practitioners, even though we did this for 20 years, to do the laser lightening of the pigment, and now only person with a medical status can do this. So what's your opinion about this? Is it possible to make education the way so we would be able also to do this, to keep doing this, since we have begun to do this in way more earlier than the doctors? This is a very personal question for me.
You're asking a doctor, so it's not very easy because the legislation is different according to countries. In France, it's only doctors. In Finland, cosmetologists can do it. Of course, if you have acquired the technique and you know how to manage, and you know also how to manage the complication, you know what to do or what to suggest.
This is what you said earlier, that this is important. Who teach you to do this treatment?
It's a teaching.
If the person is well educated and understand an issue completely, then
Of course, we could imagine then a training, because you would have to need a training anyway, and by different persons, because we know that the company who sells the laser, they provide like a fast training, but even as doctors, we don't consider that's enough. So could imagine some kind of training done by other doctors about the laser, the basis of the laser, etc., to avoid misuse, because there is so many ways of misuse. that it just needs that one of you do a mistake, a bad mistake, and then it's going to, like for the tattoo problem, it's going to fall on you all. So yes, I think that yes, it's safe, because of course in laser in general, there's lots of lasers that are done by assistants and not by doctors actually.
Under the supervision.
Yeah, not in the same room. We know that he's not there, but the assistant.
He looks from the distance.
So we know. So yeah, of course. So the assistant know how to do the thing. So yes, we could imagine with a proper training of several hours, with several days, by people who are. And most likely, for those who are really learning, they have to do like a rotation to see how you do it, etc. That could be, of course, totally possible, I think. Yeah.
Well, and for the doctors in reverse, this is also necessary to focus on this specific treatment to understand the pigment composition, the possible reactions, and not all of the doctors do this. They just have a machine which does with the pigmentation, with blood vessels, and with tattoos, just like an extra. So this is the problem from the both sizes, I believe. Everyone needs this education from the proper person.
Yeah, of course, I have seen laser removal complication at my clinic that has been done by doctors and not by a beautician or anyone else. So yes, there are doctors who don't know how to use it and are making also a big complication, of course. So it's really not protecting us to be a doctor. That's true.
Let's finalize this talk. Could you please wish to permanent makeup practitioners something which could inspire us to keep working to educate ourselves?
Yeah, so I totally wish that the permanent makeup artists can have their own training on their own and don't need to be doing unnecessary training, because like tattooists, the permanent makeup artists have their own knowledge. You know how to do your job, you know how to do the eyebrow, you know how to do the lip, etc. So it's not necessary to put you extra training which are unnecessary for your work because it does not affect you. So yes, you should have your own line of work, your own line of training to become the most safest and professional makeup artist. So I wish you that.
Amen. Thank you.
Thank you.